Chapter 2 Dental Basics from the ADA book. The administrative dental assistant has the unique opportunity to communicate in several languages. Patients are often unwilling or unable to ask the dentist questions directly. If you are unable to understand the dental language, it will be difficult to be effective at your job. Basic dental office design includes the non clinical areas, including the reception area, business office and administrative area, consultation area, the doctor's private office, the staff room, and any other additional non clinical areas. Then we have the clinical area, including treatment rooms, sterilization area, dental laboratory area, and additional clinical areas. Basic structures of the face and oral cavity include skull, oral cavity, lips and cheeks, frenum, tongue, salivary glands, hard and soft palates, oral mucosa, and gingiva. Tissues of the oral cavity include oral mucosa, lining mucosa, masticatory mucosa, and gingiva. Basic anatomical structures and tissues of the teeth. The anatomical structures include the crown, cervix, and root. The tissues of a tooth include the enamel, dentin, periodontal ligament, the pulp chamber and tissue, the apical foramen, and the pulp cavity. Dental arches include the upper maxillary and the lower or mandibular. These can be divided into quadrants: the maxillary right, maxillary left, mandibular left, and mandibular right, or sextants: the maxillary right posterior, maxillary anterior, maxillary left posterior, mandibular left posterior, mandibular anterior, and mandibular right posterior in order. Occlusion is the relationship between the maxillary or upper arch and the mandibular arch or lower arch in terms of the way they meet or touch. In perfect occlusion, teeth meet at specific contact points. In malocclusion, teeth are out of alignment or occlusion. Types of teeth include the primary, permanent, anterior, posterior, and then each tooth is also divided into sections that are called surfaces. The surfaces include the proximal, interproximal, mesial, distal, buccal, lingual, occlusal, incisal, labial, and facial. Numbering systems. The universal or national numbering system is the one that is most used and we will use here in class. It's important, though, to know that there are also international standards organization and a symbolic numbering system or Palmer notation. Charting methods include color coding, charting symbols, and then also knowing the types of dental charts. And the dental procedures that you could see can include basic and preventative, restorative, prosthetic dentistry, surgical, endodontic, and then any other common procedures such as sealant application. Basic chairside dental assisting would include seating and dismissing a patient, digital images, and also taking radiographs, conforming to the Occupational Safety and Health Administration, or OSHA, and including infection control in your daily tasks.